All right, hello, my name is Chris Taylor. I'm CEO of OsteoApp.ai. And the picture you see up there is my mother. 2019 fell, had a fragility fracture on her wrist. This spring fell again, had another fragility fracture. In both cases, she was not screened for osteoporosis at this point in time. We still don't know how severe or what the issue really is. So what's the problem? DEXA is the problem. Inconvenient, expensive, hard to access. Less than 70% of women over the age of 55 who have a fragility fracture are ever screened for osteoporosis. Difficult to get to, highly technical to use. What's the solution? We've developed an AI algorithm that can read a standard X-ray. What does this mean? When you go in for an orthopedic visit, the first thing they do, go across the hallway, get my own images. We can read that image, develop a BMD report, just like a DEXA machine can do. Do that in less than 30 seconds. It's back into the orthopedic surgeon's hands before they're even back in the exam room with the patient. How are we doing this? So we partnered with a Mayo platform. They are delivering the data sets. And we are in the process right now of developing an AI algorithm with DEXA level accuracy to be able to read these X-rays. Right now, we are in our data prep and AI model development phase. We're looking for a 510K submission sometime around October with full commercial launch in Q1 of 2024. How do we get paid for this? We filed for and received, as of the first of this year, CPT codes, and we're looking at about a $40 per report and interpretation reimbursement around that. It's about a $1.5 billion treatment market, and we have a revenue opportunity of around $243 million. How do we win? A lot of this is focused on radiology and FTE improvement and workflow efficiency. That's where AI lives right now. We're focused on clinical utility and clinical outcomes and value of care. So right now we're looking for contacts and orthopedic surgeon groups interested in pilots and helping us coordinate utilization around the product. And lastly, we're looking for funding to finish out of all of our development and also finance the pilots with those sites. Our leadership team has over 30 years of experience in this area. And thank you very much.
So my question is, would this be a standalone app or would this be integrated into whatever systems the health system already has?
Yeah, software sits behind the firewall on the PACS system and reads the image that comes right into the PACS system. It's a passive read. The orthopedic surgeon, the doctor, or attending physician, there's no special checkbox. There's nothing in the EHR that they have to do differently. It reads it passively behind the scenes. Then it turns it into what we call a DICOM image, which is essentially the same standard as the X-ray, and moves it along right into the attending physician's inbox.
So the data doesn't necessarily have to even leave the workflow. It would just be
correct.
Intercepted.
Absolutely. Yeah, we read the data that comes right off the PACS system, do the DICOM image, goes right on its way.
Is the current competition that you're looking at the existing bone density screens or the lack of availability to those? Can you state the competition a little bit more clearly?
Yeah, great question. So two things. One is different modality. So a lot of focus on like MRI and CT technology, not X-ray technology. So a lot of focus on like lower lumbar spinal region. And so they're doing a lot of reads within that region. So VCF technology has been around for about 4 or 5 years. Lower volume, not as prevalent. What we need to do is start moving upstream from that point at the point of care. And you're going to see a much higher prevalence in volume related X-rays, hand, wrist, shoulder, knee, major joint, that sort of thing.
I guess how accurate is this in terms of the data output?
Yeah, so some of the commensurate studies that we're comparing ourselves are within a standard deviation of the DEXA results. Now, a lot of that is still focusing on lower lumbar region, but at this point in time, we have high confidence in working with Mayo platform that we're going to be able to achieve similar outcomes.